I'm a training and content. I'm a training and content development coordinator. I've been with the NHRC for about a year formally. I've been doing consulting and curriculum development for about 9 years with the NHRC. So I'm really happy to be able to put a lot of my experience working in various syringe service programs and behavioral health clinics into a more structured presentation for you all. My background is in clinical mental health counseling. I'm about 100 hours short of finishing that sacred license. So everybody cross your fingers. All right, thank you very much for that. I appreciate all the good vibes in the universe. If you ever need to get a hold of me, there is my contact information. Phone is usually not the best way to get a hold of me, so please, though, feel free to use that email address for anything. It's just curryizzo@harmreduction.org. Hey, and when we're talking about what our hope is for you all today, it's really to help improve those engagement skills for people who are using different substances, or they might be engaging in other types of behavior that carry some kind of risk to themselves or to others or the community. By really utilizing these philosophies of harm reduction that we talked about in the previous training. If you didn't attend that training, don't worry at all. I'm going to reference a lot of the foundational principles today. We're really going to be looking at that emphasis on motivational interviewing. If anyone feels comfortable, you can pop in the chat, or if you have your video on, you can raise your hand. How many of you have some really extensive experience with motivational interviewing? Fantastic. One of the things that I love about motivational interviewing, and I use it all the time, is that every time I attend a training, I learn something new. And one of the things we're really going to be focusing on today is the spirit. Does anyone want to pop in or unmute yourselves? Why are we going to be focusing so heavily on the spirit today? Keeping in mind, I'm from the National Harm Reduction Coalition. Anybody? Yeah, Todd.
I would say, engaging with the spirit side of a person, that's going to their roots and things that are, it's very important values for them. And that's usually where our conscious comes from, or it's all connected, and that spiritual dimension is something that's very private, but very personal, and it's something that I want to say it removes a judgment bias. You can't force someone to believe in something that they're not ready or don't want to believe in. And yet, if there is that foundation or that seed planted, that can really help them grow if they tap into it.
Todd, I gotta tell you, I think I like your definition of spirit better than Bill Miller's. That was absolutely lovely. Does anybody have any other thoughts on why we're going to spend a little bit more time on the spirit than some of the clinical strategies? Just checking my chat. Okay, I won't leave you hanging. Really and truly, the reason we're going to be spending a little bit more time on the spirit of motivational interviewing is because the spirit and the principles of harm reduction are almost perfectly aligned. And we're going to be watching a very short clip of, if nobody's familiar with the creators of motivational interviewing, it really came out of one particular person's experience, Bill Miller, working in alcohol treatment centers. And he saw how people were being treated, and he saw that it wasn't working, that the way people were being treated was, quite frankly, unconscionable. And those are his words in various interviews. So the hope was that they could create a different way of working with folks that put them in the driver's seat, that honored unequivocally their right, their fundamental human right to self-direct, that acknowledged that they were inherently capable of creating change, that they were the unconditional positive regard, that they had the motivation to create behavior change. All we needed to do as providers, as counselors, therapists, supports, was to help foster that and to help clarify it. But our goals for that person have absolutely no bearing in that relationship. It's all about what that person wants. And that is fundamentally what harm reduction stands for. So whenever I sometimes come across folks who say, you know, I don't know that I really believe in harm reduction. I don't really know. I'm kind of on the fence about it. Sometimes I'll go back and I'll say, okay, I hear you. I hear you. How do you feel about trauma-informed care? Oh, well, we love trauma-informed care. Love trauma-informed care. Do you use motivational interviewing? Love motivational interviewing. I've taken all the classes. I've done the extensive 5-day, trainings through the Mint Institute. Fantastic. Trauma-informed care and motivational interviewing, the spirit, those are perfectly aligned with harm reduction. Harm reduction is not asking you to do anything outside of what you already believe in and what you already value. It's just that it has to do with working with folks who use substances or engage in other high-risk behaviors like sex work. So that's what we're going to kind of kick off with, is that spirit. And throughout the rest of the training, I really hope that you all can understand those core principles of motivational interviewing, how harm reduction and that spirit go together, different strategies to promote engagement with folks who have some complex needs. And I want you throughout this entire thing to be really reflecting on your current engagement best practices and what barriers you're noticing that should or can be addressed to enhance your engagement with folks. I never want to come into a program or tell a provider what they should or should not be doing, because I don't know the folks that you're working with. I don't know the landscape that you're working in. And for me as an outsider to come in and say you're doing it wrong disregards all of the really hard work that you've put into this. I don't believe anybody gets into this field to coerce people, to train people, to wield power over people. I genuinely don't. Do those folks exist? I'm sure they do, just because statistics in life, right? But I genuinely don't believe that people go into this field for those purposes. So I want you all to reflect on your current best practices and see, as I'm speaking through this, where you can find some barriers and where you might be able to make some meaningful change with your folks at your program. Any questions thus far? All right. I also like to, I know that this is a larger group. I also like to invite everybody, if you have questions or you have concerns, please unmute yourselves. You can throw things into the chat. There are a few folks, and sometimes I miss things in the chat, but if you feel comfortable unmuting, I really encourage you to do so. I'd rather people ask questions in real time than hold off and possibly forget what you were going to say at the very end. We are going to be taking about a 10-minute break. I'm going to aim for about around probably in the next 45 minutes or so. But I'll wait for there to be a natural break so that we're not in the middle of something big and leave you on a cliffhanger. All right, so let's get into it. Motivational interviewing. Let me hear from you folks. How would you describe motivational interviewing? I'm a brand new person coming into the field and I say, supposed to do this training on MI and I don't know what this is. What is this? It sounds intimidating. How would you describe it?
Hi, this is Connie.
Hi.
At first, let me apologize for being tardy. I am so sorry. I lost track of time, so I'm so sorry.
It happens.
How would I describe it? I would describe it as really having a conversation with a patient or someone, your client, whatever you call it, that for me, it's really about creating a relationship and finding out what their underlying motivation is for whatever they're doing, whether it be, I want to quit smoking, I want to quit drinking, I want to quit using, whatever it is. What is their underlying motivations? Is it family? What is going to keep them going? Because that helps me do my job better. So that's what I would say to start.
That's a lovely way to conceptualize it. And I really appreciate that you put the emphasis on what is their motivation for, because oftentimes I have seen, and I'm obviously not saying this about everybody, it's just my experience. I've seen a lot of therapists or peer supports that kind of shy away from the things that people feel as though are benefiting them from these different behaviors. And if we don't know what is motivating somebody, we can't help them. And we can't really help inspire or encourage any meaningful behavior change because we don't know what they're getting from it in the first place. So that's wonderful. Thank you for sharing that. With motivational interviewing, I mentioned it was created by Bill Miller back in 1983, so it's been around for a while. And then he partnered with Stephen Rolnick, and they really created and formalized this strategy. And this is just a quote from Stephen Rolnick's website. The one thing that I do encourage you all, if you're interested in learning more about motivational interviewing, Bill Miller and Stephen Rolnick are incredibly generous with their different materials. A lot of things are perfectly free for you to use, and you can go right to the Mint Institute. If you Google motivational interviewing, it'll take you right there. And a lot of these different things you're going to find are very easily accessible. Read this whole thing, but basically what I want you to know about motivational interviewing is that it not only was created because people who are actually doing the work saw a lot of the flaws in the current practices, but it's also very culturally adaptable. And that's not something that I think we can say about all different types of interventions and strategies. This really does allow you to be very flexible, regardless of somebody's cultural background. Now, let's talk a little bit about kind of the basic overview. Here is what I kind of consider to be my elevator pitch. It is meant to address ambivalence, not apathy. And this is a really key piece here because in my experience, people sometimes confuse the two. Apathy, I don't care. What do you want? It literally doesn't matter to me. What, you want me to do this? Fine, I'll do it. I just don't care. I just want to get it over with. Ambivalence is the opposite of that. I actually care quite a bit. I just care about both sides. I'm straddling the fence. I might tip one way a little bit more, but I still have a foot over here. We have to make sure that we are practicing motivational interviewing with authentic attention to the spirit. And we assume that whomever we are working with, that motivation for a behavior change that they're bringing to us, it already exists within them. We are not here to light any fires or create any sparks. That is completely the opposite of MI. We are here to look at what already exists and help develop that, help encourage it, help that person clarify what they really want. But if we are creating motivation, we are no longer engaging in motivational interviewing. We are not here to create it. So this is really important, and where clarifying your own values in your own therapeutic style, your own engagement style is going to be really important, because if you're walking into a situation with somebody and they are engaging in a behavior that is really difficult for you to understand, or something that you maybe fundamentally disagree with, are you going to be able to keep your personal opinions out of it? The interesting thing about motivational interviewing is if you have somebody who is very skilled in MI and they do not practice with the spirit, that is a potentially very dangerous person. It can be a very manipulative person. And yes, I'm using the M word. I am using it. That is a very manipulative person. That is a person who is out to change an individual because of their own beliefs and their own values. You have to practice with the spirit. What it's not, though, because motivational interviewing, it is not a catch-all for every single challenge that somebody is going through. There are absolutely different things that motivational interviewing just isn't appropriate for. Can anyone give me an example? When would you not use MI? Yes, absolutely, for grief counseling. I've seen somebody, I had an intern, lovely, well-intentioned, very, very enthusiastic about learning new things. And they had a client who was struggling with whether or not they should forgive an abusive parent. And they said, well, maybe I could use motivational interviewing. And I said, I don't think that this is appropriate for this specific situation. There's a lot more going on. There's a lot of trauma. There's a lot of other things to consider. But grief counseling, that's an excellent example. It's also not arguing or pushing or trying to convince somebody that they have a problem that needs to be changed. A person could meet all of the diagnostic criteria for substance use disorder. They could check every box on that list. And if that person fundamentally does not believe that they have a problem and they do not want to work on it, we are not using motivational interviewing. That person is pre-contemplative for that specific thing. Now, they might be contemplative in a different area. They might be willing to acknowledge other things that might be able to be changed, but that specific thing we might have to let go of. They might be willing to change how they interact with others, and then motivational interviewing comes into play. Or they might say, maybe I should change. Maybe I should consider going to rehab. I don't think I have a problem. Maybe I should consider. That's something that maybe we can work with, because there are actual feelings attached to why they should or should not do something. But we're not here to argue you have a problem, period, full stop. It's also not offering direct advice or solutions. And the key piece here is without actively working with that person to make their own choice. There is a piece of motivational interviewing where it absolutely can be appropriate to give somebody counsel or psychoeducation, or this is something you might want to consider. That's absolutely appropriate. We do not do that, however, if we are not actively working with that person. So we're not having that individual in our office and we're saying, and motivational interviewing is used a lot with health conditions. So we're not going to bring somebody into our office saying, you need to take your medication and here's why, because this is happening and this is happening. And you told me that your life is spiraling out of control and you're experiencing these different symptoms. So you have to take your medication because this is what's going to help you feel better. All right, I'll see you next week. That's not what we're doing. We're also not taking that expert or authoritarian stance, again, leaving that person in the back seat. We are not here to lord over them. We are not here to impart our wisdom. We are here to work with them. And we are not going to be doing a majority of the talking. We might do some talking when it feels relevant, especially if we're providing psychoeducation. But for most of the time, we really want to be encouraging the person that we're working with to do the majority of the talking. We also don't want, though, I know I keep referencing that person being in the driver's seat, but we don't want that individual to have complete and total control over what is being discussed. So they're not there to determine the direction and content of what we're talking about. We do want to keep some boundaries in place about what we're talking about so that it doesn't get off track and we're actually meeting goals. Boundaries are good, right? That's what we're talking about here. And of course, it's not coercive or punitive. When are you going to utilize those skills? When ambivalence is high and people feel really stuck. So, for example, I know I should go to the gym. But you know what? I'm really tired. I'm really busy. I work 3 jobs. It's really expensive. I know I'd feel better though. I know I'd feel better and I'd have more energy and I could probably, lower my high cholesterol. I could probably lower my blood pressure and it might help alleviate some of that stress. That's what we're talking about here. I have 2 very big sides of the scale. It's also great to use when people aren't feeling really comfortable or confident about their ability to change. We're going to talk a lot about self-efficacy. It's also great when somebody doesn't really know if they want to make that change. I actually had somebody, I had a lovely supervisor years ago. I was contemplating something and I said, I know I should, I know I need to, and I have to do this and I have to do this. And she looks at me and she says, I've heard you say a lot of shoulds, a lot of needs to, a lot of haves to. I haven't once heard you say that you want to. And it was this big kind of aha moment where I just thought, I don't want to. I actually don't want to do this. And it's incredible how freeing that can be. But sometimes folks don't always know that they can say that. It's there. It's just helping to give people the vocabulary and helping to kind of sort through the language that they're using to get to those aha moments. We're going to talk about how to do that. And then, of course, finally, it's great to use when somebody might not consider this particular change to be of great importance, or maybe they're really not sure about how it's going to benefit in the long run, or what is going to happen in their current situation. So if people are having strong feelings on either side, they're not feeling strong and capable about being able to make the change, not really sure they want to make the change, and they're not really sure that the change is that important, this is where you're going to use those motivational interviewing skills. Okay. I'm going to play a very short clip. This is from one of Stephen Rolnick's talks, and I think he summarizes this really well in terms of why the spirit is so important and how it can benefit us in terms of engagement.
denial and resistance in people, if you think about that I went through, is not a property of the pathology of the individual. It says something about the relationship. That's to be consistent as a friend. See the point? Because, but you know what I'm saying? You've got to be very is that if you shift your style, this is the motivation to change improves.
I apologize. Let me see if I can get it to replay. It's short, so just bear with me for 1 second. Try this again. Okay, Todd, I can see you directly underneath you, right directly underneath me. Can you give me a thumbs up when you hear it?
Denial and resistance in people, if you think about that I went through, is not a property of the pathology of the individual, okay, but says something about the relationship. My 15-year-old lies to me consistently, but not to his best friend. Do you see the point? Yeah, okay, so, but you know what I'm saying. You've got to be very careful. And what Miller and I shared then and now is that if you shift your style, this is the basic observation, the motivation to change improves in front of your eyes. And that shift in style is not just a technical matter, it's your attitude towards this person. And so associated with that style shift is a whole lot of things that you saw in Conversation B, which we'll have a look at in a moment. Again, but I think which can be captured by this. Try not to judge, try not to blame, try not to label the person. Try and be respectful, reflective, as your colleagues have said. And the motivation to change can come from within them. They have the energy and the motivation and the good sense to change inside them, and much of the capacity and skills to make change happen if you give them the space to do that. And that's a very different approach to what I saw in that addiction treatment unit, and Miller had noticed in addiction treatment settings in the United States, where his stories were the equivalent of mine. I mean, there were some stories that he told me and still tells me that truly make me shocked.
What do we think? Any thoughts? I like this clip because I appreciate how he starts out by saying lying is not and people lie for a lot of different reasons, but mostly it has to do with the relationship. And talking about how, my 15-year-old lies to me all the time, but not his best friend. Why? Because parents are authority figures. There's a power dynamic there. I've noticed that a lot of the different therapists and providers that I work with, they get very hung up sometimes. And why is my client lying to me? And I'd often reflect back and say, I don't know that they're lying to you. I think that there's a big piece of this that is rooted in distrust of systems. I don't know that I can trust you. I don't know that you're a safe person to trust. I don't know that I'm comfortable telling the truth because of how it makes me feel. There's a lot of other things happening besides, I'm going to lie to you because I think you're stupid and I want you to feel stupid. Maybe there are folks out there that do that. I don't know. I don't know every single person in the world. But my experience typically is not like that. My experience is lying and things like that come from not trusting the relationship, not trusting what's going to happen with that information. And it's really interesting what that simple reframe can do. The folks that you're working with who have substance use disorders or who engage in, who engage in sex work, I have found that these folks are so finely tuned for survival. Most oftentimes, coming into treatment or engaging with people in any time of treatment or recovery setting, most oftentimes this is not going to be that person's first attempt. Sometimes it might be, but oftentimes it's not. And that person has a whole host of experiences that came before the experience they're having with you right now. And what's that saying, the paying for the sins of our fathers. There's something to that. There's something to that in trying to reformulate a relationship with somebody who might have had some really bad experiences. And in this moment right now, meeting you for the first time, genuinely doesn't have a reason to trust you. We tell them, this is confidential. We tell them, you can trust me, you can, all these different things. This is a safe space. And yet there might have been providers who said that same thing and maybe did not communicate things to them in a way that they understood that had some negative consequences. Or maybe this is a person who went through an abstinence-only treatment setting or went through a really rigid treatment setting before and doesn't trust that things can be better or things that have evolved. So just kind of keep that in mind. Motivational interviewing really stresses that partnership, that spirit, to help enhance these relationships so that people feel comfortable exploring authentically what's holding them back and where they want to go. So some of those key qualities, again, motivational interviewing, it's a guiding style of communication. It focuses on really strong listening skills and then balances it with giving information and advice when necessary and when it makes sense. It is meant to empower people by showing them that they already have all the tools within them to make these difficult changes. We are simply there to encourage and highlight what is already there. We want people to recognize their inherent worth, their inherent strength, their inherent drive, their inherent motivation. And it's also really respectful. And it's a way of being curious with that person by honoring their autonomy, their fundamental human right to self-direct. So it also requires us to engage with folks on equal footing. So we don't give that unsolicited advice. We don't do that, well, if it were me, this might be a really good idea, but I got to tell you, based on how I know you, I'm not really sure that that's what's going to be best. We don't ever really know what's truly going on with somebody. We might have the strongest relationship, and I encourage you also to think about relationships in your own life. You might have somebody in your life that you know inside and out, and yet you do not know everything about that person. And that person might still make decisions or choices that you might not understand or might not agree with because they are them and you are you. So we have to acknowledge that same thing with our clients. We're not here to get people to change. And when we are engaging in motivational interviewing, it can take time. We can absolutely practice some of these different strategies in very time-limited settings, of course, 100%. And ongoing, it can take some time. It requires a lot of self-awareness, your own values clarification as a provider, and a lot of discipline. Because again, if you are very strong in providing motivational interviewing, you are a really strong provider, you understand these principles and how to use them, you are a dangerous person if you are not practicing it with that attention to spirit and you're not practicing it from an authentic way. So again, self-awareness, your own discipline, your own values clarification. Motivational interviewing really relies a lot on building someone's sense of self-efficacy. I'm sure you've seen this quote before, whether you think you can or you think you can't, you're right. It's on literally every gym wall that I have ever quit and donated a membership to. But this is important because you might be working again with folks. A very common thing that I would hear, and if you've heard this before, feel free to raise your hand. I've definitely had folks come into treatment and say, yeah, I'm in group for so-and-so, but you know what, at this point, I could probably run it. Yep, yeah. What that tells me is that this person doesn't really think that there's a lot that they're going to get out of this. Why? Because they can teach it at this point. Why? Because this is maybe their 4th, 5th, 7th, 10th, 12th time doing this. So what makes that person think that the 13th time, the 2nd time, the 8th time, that one's going to be different if all the ones that came before it weren't? We have to avoid, us as providers, we have to avoid falling into that revolving door trap. Reconceptualizing people as each time they come back, this is a strength and not just a, oh, okay, you're back, you know the drill. No, this is a new opportunity for you to inspire and hopefully encourage some motivation. If people were completely motivationless, they wouldn't be there. So there is something there. I had a professor who once really did not like the term resistant. She always preferred the term reluctant. And it always stuck with me because she said if somebody was genuinely resistant, they wouldn't be talking to you. And I don't really know if that's really true or false, but it has helped me kind of think, okay, if a person doesn't want to work on this, then what do they want to work on? Where is the motivation? Much like Connie, you had mentioned, where is that motivation? Because if they were motivationless, they would not be engaging. So with self-efficacy, again, it's that critical determinant of behavior change. A person can want to do something. A person can feel as though all the circumstances are set up for them to be able to do that thing. And if they don't feel like they can, that behavior change is not going to happen. Wanting something does not make it so. Needing to do something does not make it so if you don't believe that you can actually do it. And here again, in motivational interviewing, if you've ever taken some of those classes, there's a really big piece there where think about your own selves. When have you really needed to do something or felt like it was an important thing to do and you just couldn't because you didn't believe it? And believing in ourselves is a hard thing to do. And this is also where it gets really tricky. So to kind of go back to what I said about, being resistant and fostering self-efficacy, folks who are mandated to treatment, this is kind of a whole different area. With folks who are mandated, oftentimes, and if you've had those folks in your office are like, listen, I don't want to be here. What do I have to do to get out of this situation? They might not necessarily want to work on the thing that they're there for, but there might be other things that they are willing to work on. So kind of like, if a person says, listen, I don't have a problem. I know I meet all the criteria, whatever, and I have this diagnosis, whatever, and I have all these legal issues, fine, whatever. But honestly, I really don't think I have a problem. I don't know how productive it is to sit there and argue, right? I don't know many providers who want to engage in that. But typically, there is a reason that's propelling them here. It might be staying out of jail. That can be a very compelling reason. And at the same time, this can also be the time to give that person space to maybe explore some things that they are interested in. And we're going to talk about one of my very favorite tools for this in a little bit. So hang tight. If anyone is here thinking, how do I engage with mandated clients? I am not somebody who thrives working with adolescents. Oftentimes I look at adolescents as people who are mandated by parents. So it feels very similar for me. And this is something that I do with them. And if you work with adolescents, you have probably, first of all, you have a lot of patience. I know that already about you because I have some folks that I work with that spend an incredible amount of time playing Uno. I don't know how to play Uno, and I'm starting to realize I desperately need to learn. But a lot of times there are just games, there's things like that to build rapport and make people feel safe, especially adolescents. The same thing goes true for adults. Yes, you're going to have to write a report, but oftentimes reports, at least in my area, are did they come? Are they making their appointments? And it doesn't really need to go into the nitty gritty of what you're doing. So hang tight if you're kind of still on that, what do I do with mandated clients? All right, so that spirit, just to kind of go a little bit more, we are looking at partnership, we are looking at acceptance. And if you took that part one of the foundations of harm reduction, this should sound very similar to our principles. So we respect, for us, it's health and dignity. We work with people, everything is participant centered. So here you see it, it's for and with the person. It's not something done on or to them. It's a collaboration. That acceptance piece, we respect people as they are, their right to self-direct, we acknowledge their strengths and efforts, and we try and understand that person's experience. So that goes to harm reduction principles of understanding sociocultural factors, participant autonomy. It's really beautifully paired. We also look at the evocation. So this is exploring somebody's own beliefs because that is where their motivation is going to come from. If they don't believe in something or they don't value something, trying to inspire change around a faulty belief or a faulty value that we perceive that they don't actually have is going to fail every single time. Behavior change comes when it is aligned with what we value and we believe. And of course, that compassion piece. We are actively promoting their welfare and their own best interests. And sometimes that means taking a step back and saying, I don't really understand why you necessarily want to make this specific change, or maybe prioritize this over this, or why you want to go in this direction versus this direction. But you are an autonomous human being. You do know what's best for you. So here we are. One interesting example of this is I had a client who was involved in drug court. I'm not really sure about the drug courts where you all are from, so I can only speak from my experience. But drug courts can almost drag out indefinitely. It can be very tricky. And I remember talking with this person. They said, I want to go to jail. I want to go to jail. I want to do my 6 months. I've been in jail. I think one of their good friends was at the county jail. They're like, I've done this before. I know nobody gets it, but I just want to go do my 6 months. Every time, I'm getting called, I have to come in here. I have to do this. I have to do this. I have to do observed taxes. I'm traumatized every single time. And of course, their wording was a little different. I'm obviously paraphrasing, but it was really difficult because for me, going to jail is a consequence that I'm not necessarily comfortable with. For some folks, though, that might be something that they are, and it might make sense for them. For this person, doing drug court was more intrusive in their life than having 6 months where they knew what to expect. They were already struggling with housing. There was domestic violence happening. So in their mind, they were like, I already know this system. I know what to expect. I'll be stably housed. I'll have some time to figure some things out. So for them, that's what they felt was best for them. And unfortunately, the court did not agree. And it was a very strange, very, very strange situation. But anyway, I digress. So again, talking about that spirit, our clients, we assume that they have everything already within them. We conduct, we don't coerce. We inspire that change. We help draw it out by looking at what they already value, what their perceptions of what's happening, what that actually is, what their values are. And we really have to accept they do have that right not to change. They do. We might not like it. We might have all these difficult feelings. And you know what? That is where supervision comes in. That is where having a strong supervisor comes in. Put this in the chat for you towards the end so that you can watch it just for the sake of time. But basically, Bill Miller really talks about how all of this, everything that we talked about, the spirit, this applies to how we interact with folks on a day-to-day basis. This also goes into leadership and behavioral health settings. It goes into leadership and just general organizational development. So the spirit is all around us. And if we practice it authentically, not just with our clients, but with each other, with our employees, with our staff, with our coworkers, it really can enhance everybody's overall motivation. So I'll be sure to drop that in the chat for you. About some of those principles and strategies, though, because I'm sure that that's probably, you might be thinking, and what may want to make any assumptions, but you might be thinking, okay, I got it, the spirit, important, be a good person, practice authentically, got it. How do I actually do that? So here is where that comes in. Now, if you are somebody who has a level of expertise in motivational interviewing, you know that there is so much nuance to it. There is an incredible amount of nuance. There are weeks-long classes that you can take on this that are intensive, that will teach you all of these in great depth. We're not going to do that. I'm giving you the real Cliff's Notes version here. But these are some of the things that I have found to be of most importance when helping people develop their motivational interviewing skills, because not everybody has the ability to take some of those intensive trainings. So if you are going to walk away with anything, here are some of the fundamentals. And if you are somebody who has that level of expertise, sometimes going back to the fundamentals can be really helpful in reinvigorating your own motivation when working with folks. So let's talk about it. We have done a little bit with expressing empathy. Hopefully you all know what that means. And avoiding argumentation. We don't argue with people, right? That's kind of a big no-no. I think universally in any kind of therapeutic setting, we don't argue with people. Whenever we're engaging in a power struggle, we lose. Power struggle, nobody wins. It's not possible to win a power struggle. So if anyone here is of the act mindset, drop the rope. You got to drop the rope sometimes. We do not argue with folks. But we're going to get into a little bit more detail on some of the other ones. So with expressing empathy, be authentic. You don't have to agree with the behavior, of course. Try and find something, though, that you can empathize with. Somebody might be doing some really troubling things. Is there some piece of them that you can empathize with? It might be the child who went through trauma and is now presenting as an adult with troubling behaviors. Is it somebody who grew up with no money and is now resorting to some not great behaviors to get money? Whatever it may be, is there something about them that you can empathize with? I'm sure there is. I'm sure there is. And if there isn't, again, I can't overstate it enough. Find a good supervisor. Talk with other folks, share your difficulties. I can't think of anybody that I would have less, I can't think of anybody that I would lose respect for if they came to me asking for consultation or for advice, or because they were struggling. To me, I see that as a sign of a great provider. Any provider who tells me, no, I know it all, I know exactly what needs to be done, I'm completely immune to any kind of personal feelings about this situation, I got to tell you, I don't really trust you. Teach me your ways or don't, I don't know, but I have a hard time trusting people like that because I don't know how possible that really is. Our humanity, our empathy is rooted in us being able to have that. I might not know exactly what you're going through, but I can find pieces of your story and your experience that resonate with me. We have to use ourselves. Developing discrepancy is one of my favorite things to happen. And if you've ever seen this happen in real time, it's those aha moments that can be incredibly validating and incredibly transformative in a session. So what we're really talking about here is when we are able to point out to somebody how what their current behavior is not really meshing with their stated goals or what they claim to say that they want. And it helps that person kind of see what they're currently engaging in. It doesn't fit in with how they want to see their future. So some examples of this might say, so let's say, we'll take my example going to the gym, right? I might say, I'm just really not, I don't want to spend the money and I don't like going to the gym. I don't like sweating. I don't like the smell. I don't know. And somebody might say, okay, I hear you. I hear that the money is, a concern and things like that. And you're also saying that you want to be healthier because you have children and you're worried about your blood pressure. So how does not wanting to take care of yourself and put in that effort really fit in with your overall goal of wanting to be healthier, take care of your heart, and be there for your kids? That's a really hard thing to have put in front of you. And I say that as somebody who's seen it happen and somebody who has had that happen to them. This is a really hard thing to argue against because I don't want to say you're using someone's words against them because that sounds very punitive, but essentially you are reflecting back those two sides in real time. So developing discrepancy can be an incredible thing. And one of my favorite things to do to help develop discrepancy is using the value card sort, which we are definitely going to be talking about in a little bit. Anybody here familiar with the value card sort? Anyone here use it? I'm trying to contain my enthusiasm a little bit. All right. And then rolling with resistance. This is different than avoiding argumentation, okay? Rolling with resistance is accepting that people do ebb and flow, and that is incredibly natural. It is a part of the change process. For somebody to not ebb and flow, I suppose somebody might not ebb and flow, but then I would question, why are we doing motivational interviewing? Because it doesn't seem like there's kind of looking at the two sides of things. So it's normal for people to kind of push back. Not only that, change is hard. If change wasn't hard, none of us would have jobs. None of us would have our own struggles. Change is hard. Some change is harder than others, but all change can come with a level of discomfort. So we want to be validating that person's concerns. We want to be managing our own internal sometimes frustrations, our own internal disappointments. It can happen to the best of providers. Know when you might need to shift focus. I had a nurse practitioner who called it "help me, you can't." And the best way I can kind of describe it is when this starts to happen when the provider starts working harder than the person. And now we're trying to come up with solutions, and the person kind of always is throwing back an excuse of why they can't. Well, I tried that. Well, I tried that. Well, it doesn't make any difference if I don't do this. And that's a good example of maybe it's time to shift focus to something else that they are willing to engage on, because that situation where the person gets into the "help me, you can't," it's unproductive. Nothing good is going to come of it. And that can change. The next time you see that person, they might not be in that mindset. But in that moment, when you start to realize this person is kind of "help me, you can't," and kind of throwing back any suggestion you offer, you are now probably working harder than they are, and it's time to let it go. You can shift focus to something else and come back to it if it makes sense. And of course, emphasizing personal choice, because at the end of the day, it's up to them, right? So I think we're going to wrap up with ORS, and then we'll take our break. Is everybody okay with that? All right. So ORS, this is just a simple acronym. Motivational interviewing loves a good acronym. And really all it is open-ended questions, affirmations, reflective listening, and summaries. And this is kind of how you guide your interactions with folks. It sounds simple, right? Open-ended questions. I got to tell you, I have noticed myself and in others, there can be a tendency for folks to kind of stick to the same ones. Try and mix it up a little bit. Instead of, can you tell me a little bit about, if you keep doing that over and over and over again, it can sound redundant. So try and mix it up a little bit. Why might it be that? Or can you give me an idea of, or how would that work if? But try and pepper in new ones. And it's interesting because me giving you these examples, I do this all the time. I do this training probably once or twice a week, some iteration of this. Even just now, I had difficulty coming up with an example because my go-to is tell. So think about for yourselves how you mix up the different words that you ask, because each different word listed up here is going to give you a different response. Tell me how, this, and this is different than how might it work if. So we can combine these words, but they are going to give us different outcomes a lot of the time. So try and mix it up a little bit. All right, let's talk about affirmations. The biggest thing I want everyone to know with affirmations is this is not everybody gets a cookie. Affirmations have to be rooted in authenticity and meaning to that person. They have to be rooted, they kind of have to be highlighting something that's important to that person. And we really don't want it to be that low-hanging fruit. So we want to acknowledge any positive change that person is making, but we don't want to have them be very hollow. Kind of a very standard one is, oh, yes, of course. Of course you can, there's going to be a recording of this. I'm just noticing in the chat, there's going to be a recording of this, but I don't see, I'll touch base with Rebecca. I don't see any reason why I can't put these in a PDF and we can work something out. Affirmations, try not to have them be that standard, at least you showed up today. Any affirmation that starts out with "at least," don't say it. just a general kind of golden rule. Try and stay away from any affirmations that start with "at least." Affirmations, again, really want to be rooted in what that person values, and it should be reflecting something that is actually changing about their behavior. So for example, if I came into work late and my supervisor comes over to me and says, "Hey, Shannon, what's going on?" And I say, today was just such a mess. I was so discombobulated. My kids were sick. I had to take them here, here, and here. I didn't get a chance to get my coffee. I'm just off my game and everything like that. And she says to me, "Well, Shannon, you made it here on time, and that's awesome. I'm here on time every day. I'm always on time. Actually, I'm usually early." That's an affirmation that really doesn't mean anything to me. Does that make sense to everybody? We really want them to be meaningful to that person. If you genuinely can't find something to affirm, don't affirm. You might struggle with that, but don't make something up. Don't guess at something, because it will come across as inauthentic. And we want to preserve that authenticity. If you are struggling in the moment and can't come up with a strong affirmation, you can simply just validate that person's experience. That sounds really hard. It sounds like you really went through it today. And at the end of the day, one kind of standard thing you can say is, thanks for showing up. Thanks for still making the decision to show up. It can be that simple. And reflective listening, this is not parroting. We don't want to be engaging with somebody and just repeating their words back to them. What we do want to do is we can repeat it with different inflections in our voice, reframing thoughts and things like that. This really gives that person an opportunity to say, I don't know if that's really what I meant, or yeah, that's what I was struggling to say. And it might also be an opportunity for somebody to say, I didn't say that. That's not what I meant. And give them the space to explore that. A good example of this is, just to kind of give you an idea, because this happened the other day. This is a really powerful one. There's something called an amplified reflection. I hear a lot from folks who are in really difficult circumstances say things like, I'm just an addict. Like, what's it going to matter? I'm just an addict. I'm just like another person. Has anyone ever heard that before? Somebody really kind of like talking about themselves in very absolute negative terms. Watch what happens when you do an amplified reflections. You're just an addict. You're just an addict. And let them sit with that for a second. They might say yes. In which case you have learned something incredibly important about them, that their sense of identity is rooted in this, and they might not see themselves outside of that. Or you might learn something really incredible about that person. Well, no, obviously I'm not just an addict. I mean, I'm a mom. I have a job. Those are strengths. Those are strengths that person might not have an opportunity to talk a whole lot about. So reflections can be really powerful moments of working with folks. I love using amplified reflections because I love picking up on people's wording, but you can do this in all different types of ways. And I encourage you to, because you can't sustain an entire session on an amplified reflection. So use a combination. A simple reflection might just be, yeah, you really struggled this morning getting to work. Sounds like you really went through it and everything was just really discombobulated. Or it might be, wow, you went through it and you're kind of feeling off your game because your routine was completely disrupted. That's a great way of just kind of taking what that person is saying and adding a little bit more meaning to it. And summaries are a fantastic way of wrapping up your session or wrapping up some chunks of discussion. One of the things that I struggle with ending sessions on time because I never want to cut somebody off. And if you've ever been in this situation where it's coming up on, let's say you have an hour to meet with somebody and it's coming up on 55 minutes and all of a sudden that person says, I'm so glad I got a chance to come in and talk to you because, my mom died the other day and I wasn't sure who I was going to talk to about it. And I just didn't think it was going to impact me the most. Anyone ever have that happen? And you might be thinking, I have other people that I need to see. I have 5 minutes and this is a major trauma that just happened. That can be a really difficult space to be in because we obviously want to honor what that person is going through and not cut them off completely. And those kind of big announcements at the end can be avoided if you start with your summary early. So with your summary, this is making sure that you are kind of recapping everything that has happened thus far. You want to make special attention to where that person talked about changes they wanted to make. You want to make special attention to where that person is struggling with ambivalence. And you can always end it with that invitation. Did I get that right? Am I reflecting everything that you said accurately? Is this kind of what you think happened in session today? How does that feel? And it helps avoid Not entirely, of course, but it does help avoid some of those big those big drops at the end of a session, because it wraps it up nicely. It's not going to completely eliminate that, because sometimes it just happens. But this is a really great way to make sure that you are both on the same page, and you can end the session in a nice calm way, that person has some sort of kind of session closure. All right, I think now is a great time to take our 10-minute break. Can everybody come back at, well, let's make it, I have 11:58. Let's make it a nice, come back at 8 after. How does that sound? We'll give it like a minute or two. Sound good? Whatever your clock says, tack on 10 minutes. All right. Anybody? Okay. All right, so let's talk a little bit about different types of talk. And this is what you really want to be paying attention to whenever you're working with folks who are trying to make some sort of a decision. We want to listen for change talk. So this is where somebody is telling you all the different reasons why they think they should, they need to, they want to make the change. This is what we hope to see over time. We want to see more change talk, and we want to see less sustained talk. So that sustained talk is, I don't think I want to go to the gym. It takes a lot of time. I don't have a lot of time. I mean, I think I should be healthier. I don't know. I just don't really, I can do it later. I can always do it at some point. That's your sustained talk. And then we have that exploration talk. So this is where we really let that person just talk out loud all the different things that they are contemplating regarding that change. Sometimes people, and given the right opportunity and given the right support, people talk themselves into change. They can also talk themselves out of change. So this is where we have to pay special attention to the words that that person is using, so that we can identify, are they starting to talk themselves into the change, or are they talking themselves out of it? If they're talking themselves out of it, it might be time to pivot and see if this is really a change that they want to make. And then, of course, that resistance talk. So that's when that person starts to say, I'm not able to do this, and I am unwilling to make this change. So when we start to hear an uptick in that resistance talk, it might be time to fall back and reconsider what we're going to be working with this person on. Nobody is 100% resistant, right? We want to find what they do want to work on. And because motivational interviewing loves a good acronym, I present you DARN CAT. So this is a nice little way of you being able to kind of track where that person's mindset is by the words that they're using. So really good positive change is going to reflect that person's ability to change, their desire, the reasons why they think they should change, and kind of that sense of need and urgency. So I would like to, I wish to, I want to, I could, I can, I would probably be better off if I did, and here's why. Listen for the person's wording, though, if any of these are missing, because a person can say that they want to and that they could, but maybe the need's not there. Change is really going to be most effective. Making that change is going to be most effective when we see a combination of these different types of speak. That's not to say they have to happen in one singular session. We do want to make note, though, over time, if that person is consistently talking about wanting to and wishing to and would like to, and none of these other are following. And then for that CAT piece, we're talking about, are they going to do it? Are they intending to do it? Are they ready to? When are they going to do it? And what steps have they actually taken? So a person might say, I want to, I need to, I ought to, I'd like to, and I don't know that I'm going to do that right now, or I can't commit to a date, or I haven't really done anything. I have to think about it a little bit more. So we want to see both of those, the DARN and the CAT. So let's talk a little bit about tools to assess readiness. This one is probably one that you're very familiar with, the decisional balance worksheet. And all of these you can actually find. It's very easy to grab these off of Google. It's essentially pros and cons. However, there's a little bit more to it. So we have the reasons why somebody wants to kind of stay the same and the reasons why they want to modify the behavior. So you want to look at all of the quadrants, not just one. Oftentimes when we do pros and cons lists, it focuses on, well, here's what happens if I stay, here's what happens if I go. But we want to look at, again, leaning into why that behavior is being sustained. What is that person getting from it? Not being shy to ask those hard questions and sometimes hear information that maybe you're not used to hearing. This is most common, I find, and I mentioned it earlier, when it comes to drug use and sex work, don't be afraid to ask, what perceived benefits is this person getting? What is sustaining this behavior? If we don't know what's sustaining it, we can't possibly help that person sort through the motivation to change it if that's what they want to do. I've absolutely had people say who are engaging in sex work, for example, the money, the flexibility. I can make my own hours and I can make the money. That's a very difficult thing to kind of come up against when we're looking at reasons to change. If that's reliable money that the person can count on, that person has a steady clientele, that person has relative autonomy and can work very flexible hours so they can attend to other things in their life, those are some pretty compelling reasons for why that behavior is not changing. So we have to be able to give that person space where they can say that this is what they like about this behavior and not feeling like they have to hide that or protect us from that. A lot of clients will do that. They will not often tell the truth about what they're getting from something because they don't want to be judged. And that's up to us to create that space where they can feel safe and know that we aren't going to judge them for that. Scaling questions. Scaling questions are so simple and so effective. So there's two different scales we're going to look at, though. We have the willingness and we have the ability, and it's really going to be important for you to look at both. So we have our first one, right? So if you were talking about a change that you wanted to make, so we'll go to the gym. How important is it for you to go? Well, I might say it's probably an 8. Okay, great. And then you can kind of get a little bit more information. So it's an 8. Why is it a 10? Why not a 10? Or you're an 8. What makes you an 8 and maybe not a 6? So you can have some interesting conversations just around exploring why they're not in different numbers. I use a lot of these scaling questions when it would come to, so in the syringe service program I worked at, I did a lot with wound care and injection counseling. And it was very common that I would have to have a discussion with somebody about going to urgent care or to emergency rooms. As I'm sure you can imagine, that is not something that a lot of people are comfortable doing or want to do. And will oftentimes, unless it's extremely severe, would opt to self-treat because of the fear of going to some of those different places. So sometimes I would say, okay, on a scale of 1 to 10, when you leave my office, how likely is it that you are going to go? How willing are you to go to the hospital? And if the person hesitated, I knew it was definitely probably going to be a 5 or below. But I might have something to work with, because if people were like, yeah, I'm not doing that, they were pretty forthcoming with that. If they were saying, no, I'm going like right now, this is my plan, I could be fairly certain that they would go. But if somebody had some of that hesitation around giving me a number, I want to explore that. Okay, let's start with a 5. Would a 5 maybe work for you? You're not really sure? Okay. So why a 5 and maybe not a 4 or a 3? Okay, a 5, what would maybe bring you up to a 7 or an 8? What would need to happen? What would you like to happen? What do you wish would happen? What do you not want to happen? And that's why you need to go. So it might be, I had one person say, I definitely don't want to go for this abscess. Okay, I can see that this is a potentially dangerous infection right now. So my whole thing would be, I want to get you there as soon as possible. That person said, I don't know, I think it might go away. Like, this has happened before. I'm not really that worried about it. Okay, all right. What would an 8 look like? What would a 9 look like? I don't know, probably if I can't breathe. Okay, all right. If you can't breathe, who do you call? Because if you can't breathe, you can't talk. So do you have a phone? Is it charged? Where are you going to be in case somebody needs to find you? those different things. And interestingly enough, in that one interaction that I'm kind of reflecting on right now, I learned that that person had asthma and they did not have their inhaler. So that was something that I actually did use to help motivate. It was, oh, how often do you think you need it? And I learned from them that it was quite often. They just hadn't had a chance to go get it refilled. And I said, you know, you do go to urgent care to get this checked out, they can make sure that you get your inhaler refilled. You can talk to them about that. And that was actually something that was motivating. You never know. You never know where somebody's motivations lie. So again, that person might be willing, but they might not have that ability. So if a person says, yeah, I'm very motivated to go to the emergency room, I'm going. Okay, how confident are you that you're going to be able to do that? And what's interesting about this is sometimes people don't realize it in the moment until you kind of confront them with this, that there are some very real barriers that might prevent them from doing this. So one person I'm thinking of in particular was like, oh no, I'm going. I said, okay, how likely, how well do you think you're going to be able to do that? Scale of 1 to 10. And they said, oh, I don't know. I have to call my partner and find out where they are. Okay, let's call and find out if they can actually take you. Partner wasn't answering the phone. Okay, what's backup? I don't have insurance. I don't know how I'm going to pay for that. Okay, all right, let's see if we can coordinate something else. So had I not asked this ability question, that person very well could have left my office and gotten outside and went to call, assuming that somebody was going to answer. It didn't happen. And now they have no plan. So combining the ability with the willingness is really important. And as promised, let's talk about the value card sort, because this is one of my favorites. Here's a QR code you can actually put up there. If you click on it, you can go, there's different ways you can do this. So there's printable versions that look just like cards. You can cut them out. I have a whole deck that's laminated. There's also an online one that you can do so that people can do right on their phones. It's very cool. Has anyone here, I think I asked this question before, how many folks here are familiar with value card sort or have done it before? Anybody? This is, interestingly enough, this is one of the motivational interviewing strategies I see utilized the least. One of the amazing things about this is it can be tangible. So for folks, and I mentioned earlier for folks who are mandated, and I've actually done this with adolescents because I don't know how to play Uno or literally any other card game. This helps me kind of understand where their minds are. So how it's meant to be sorted, and I'll show you an example. So this is used with permission. I did this with somebody at the syringe program I worked with. They're just cards and there are 83 different values. There's blank ones too that people can write in there, but it has a value and that has like a little definition underneath it. And I think originally you're supposed to sort them in 10s. I did it in 5s. There's no kind of hard and fast rules or laws around it. But essentially what you want to do is give people this deck and have them sort into important, somewhat important, and not important. So down at the end, I know it's cut off a little bit, but the one on the far right, that one is not important. The middle one is somewhat, and the left is important. So for this person, you can kind of see how they categorize things. So they wanted to find purpose, health, stability, family, and solitude. This was a person who had been struggling with their opioid use for years and was finally able to complete a recovery program. So I think you can kind of see this reflects their success. They wanted to find meaning. They wanted to take care of their health. They wanted to not be living on the street anymore, wanted to reconnect with their family and be able to be by themselves and comfortable with themselves. Why is this so helpful? This is, again, a true story. Back when I was working here, oftentimes I would have our medical providers have people come sit with me so I could try and help figure out why they weren't being, quote, compliant with their medication and so forth. It felt a little bit like I was the principal that people got sent to. And I tried really hard to not make it punitive, but to actually get some really good information that would help clarify what was holding people back from this journey that they were on. So there was one particular person that came in, and prior to meeting with me, I knew them from coming into the syringe program. They always came with their partner who was much older. I didn't know how old, but it was kind of visibly obvious that they were two very different ages. And I knew that this person had recently, there was an open CPS case and their child was removed from their custody. So they were supposed to be going to treatment as part of their menu with CPS. This person also often presented wearing very low cut, very high scooched up clothing, often presented very flirtatious with people to the point that it sometimes became problematic. It was very interesting. And all of this seemed to be kind of like with the encouragement of their partner. It was often done kind of like in front of their partner. So just really interesting kind of behaviors. So when they sat down with me, they had no interest in talking. So I said, okay, you know what, you want to look through these cards? This is something that I like to do with people just so I can get a chance to understand you a little bit better and see what's important to you. Because if this isn't important to you, then it'd be helpful to know. And they looked at me and said, well, no, obviously this is important to me. Obviously I want my child back. And I said, I totally, absolutely. But there's other things that I'm sure are important to you too. It'll be really nice to kind of learn, and things that aren't important to you, it would be helpful for me to know so that we're not offering you things that maybe aren't aligned with your values. At the end of this session, I learned family was nowhere on the importance list. Sex was not on the importance list. Relationships was not on the importance list. Love was not on the important list. It was nowhere on here. It wasn't on the not important, but it wasn't on the important and the somewhat important. What was on those? Autonomy, independence, travel, things like that, all very kind of individualistic values. So over time, what I learned about this person was they had been groomed at an early age. Their parents knew about this. There was a staggering age difference between them and their partner, and this is how their partner wanted them to present themselves. When they became pregnant, this was not a situation that they wanted or liked. So they were kind of going through the motions of doing what they thought they needed to do, but actually they were not invested in being a parent. And this was a really hard thing for me to hear. I'm a parent. I struggle to have my children. And this was I'm not going to lie. Sometimes this exercise can bring up things for people when you realize the values that you might have had some assumptions a person would have, they're not there. But all of a sudden, had I not done this exercise with that person, I would never have realized all these different things about them in the position that they were in. Nobody knew this about this client. The only reason I was able to find this out is because I literally saw it in cards and was able to ask some good questions that person was willing to answer, because they weren't really put on the spot. It was kind of, I didn't ask them, well, you say you want your kids back and I'm noticing that they're not up there. That's not how that conversation went. That's a little confrontational for me, especially when it comes to children. But what I was able to do was say, you have independence listed here. How independent do you feel? And watch their face go blank. That they didn't even know what it meant to be independent. They just wanted it. And giving them the space to explore what that would mean to them, because they never had that. They didn't feel like they had any autonomy over themselves. So we were able to do some really good work with that person. It didn't necessarily have the outcome that I might have wished for myself. But that person seemed happy with the outcome, and they ended up achieving very different goals, but ones that were meaningful to them. And because they were meaningful to them, they were able to successfully engage in recovery. So that is one of the really cool things that I've seen happen with this. So here's another example, and I like to have a little fun with it. So I would have people kind of look at what it looked like when they were in recovery. So what about in the very kind of like far left was what about in recovery, and then in the middle was what about with drug use, and what about without drug use. So people could kind of look at how their values changed. I had a couple different boards with this, and because I had an open door policy, people would just come in and like start messing around and moving them around. But it was a really cool way to learn about people. So that's something that leaving the syringe program, because that's obviously a very different environment than working with clients in an office space, but I do continue to have a whiteboard out and these cards and let people just kind of do with it what they want. And working with mandated clients, this is fascinating. It doesn't happen right off the bat. It usually takes people maybe like a couple sessions to kind of trust that it's not like silly and childish. But sometimes they happen sooner than others, and some people just don't want to engage, and that has to be okay too. When they do it, and I do have a fair amount of mandated folks who do engage in this, I have found out information about them I don't know how else I would ever have found out. It was really fascinating and opened up some really interesting, beautiful, amazing, hard, sometimes tragic conversations. But it helped me know who they were better so that I could then see a little bit more about why we were in certain situations. So many thanks to the folks who let me take pictures of this. All right, so we're just some of those engagement best practices, and hopefully you remembered from the very beginning I mentioned, I want you to be thinking about your own best practices. So here's where that's really going to kind of come into play. So first and foremost, and you don't have to acknowledge this, publicly, this can be to yourselves. How well do you feel as though you practice the spirit of motivational interviewing when you are engaging with folks on making decisions and looking at overall motivation and clarifying goals? How well do you think you adhere to this spirit? What are some of the barriers to being able to adhere to that spirit? And what might be some potential solutions to that? So let's look at some of the engagement best practices, because you might find some solutions. And we are going to start out with good old-fashioned cultural humility. I have never been shy, and at the National Harm Reduction Coalition, we've never really been shy in being critical of institutions like SAMHSA. I have to say, though, I am pleased with the updates that they made to their treatment improving protocol 59 on cultural competence. They really did a good job in honoring that the drug using community can be looked at as a distinct culture. Not only that, but recovery community. And if you're interested, they also made some really great updates to military culture. But when it comes to the drug using community, please understand that there is a cultural aspect here. And whenever we're thinking about folks who might have, might be having difficulty engaging in recovery, it can be helpful to understand from a cultural standpoint what that looks like, trying to go from the drug using community to the recovery community. And there can be some cultural difficulties there, and basically assimilating into a completely new environment with new expectations, beliefs, taboos, norms, expectations, roles, all of those different things. So I encourage you, if you're not already familiar with the drug using community as a culture and looking at it from a cultural aspect, definitely check this out. They did do a good job. Credit where credit's due. Nothing about us without us is for us. It's a central tenet of harm reduction, and it really speaks to engagement best practices. This idea, it really came out of the disability movement, but it stands for a lot of communities who have been historically marginalized and disenfranchised. But the idea that nothing positive can come unless you actively engage people in learning about how they're receiving programs and policies. So we want people who are going to be impacted by programs and policies, those individuals, we want them to have a real meaningful say in the implementation of such programs. This gets us away from that idea of, I know what's best for you, that very authoritarian, patronizing stance that can be very pervasive in public health and behavioral health. I'm not saying that anyone here is guilty of that, but I'm sure you know folks who might have that attitude. You are, quote, sick, you are struggling with a mental health concern, you're struggling with drug use, and I need to step in and I know what's going to be best for you. Harm reduction very much reject that. And in the spirit of motivational interviewing as well, and overall promoting positive engagement, we reject that too. So what we really want to do is be promoting inclusion, meaningful inclusion, not performative. So we're talking about having, when we are setting up new programs or policies, looking at how we're going to get input from people who are going to be receiving those services, and really listening and leaning into what they have to say, and trusting them with that process as well. Remember your principles, remember your harm reduction principles, and we always want to be engaging in compassionate curiosity versus cultural tourism. So what's the difference? Compassionate curiosity, and that acronym right there, why am I asking? So the best example I can give to you of this is working with an intern. There was a person who came in, they happened to be a nurse. And at the time when we would give somebody syringes, we would ask them what their drug of choice was. This person tells me that their drug of choice was bath salts. This was right around the time, and I'm sure you folks remember, there was a big news article that came out about, I think it was somebody in Florida who was on bath salts, and there was a facial assault on another person. I'm not going to get all into it. But I remembered that was really my only kind of frame of reference. This is back in like 2013. Really the only frame of reference I had for folks who were injecting bath salts. So I had asked this person, I said, you know, I am hearing a lot about this. I know that the media sensationalizes a lot of things. I haven't met anybody yet who does this, and I imagine you're not the only one. Would you mind telling me a little bit about what this experience is like and what you think would be good for other people to know? Because I don't know. Would you mind doing that? And she was so lovely and so forthcoming with her information. And when she left, I was just so grateful that I was able to get this firsthand information. And I was telling our intern, I said, yeah, this was just such an interesting conversation. I'm going to have to learn more about this because now I have other concerns from a wound care aspect and mental health and so forth. So the intern looks at me and she says, what? Oh my gosh, did you read that article about that guy who ate that person's? That is wild. Why would somebody do that? That's so weird. Okay, so what did she say? And she's a what? She's a nurse? That is wild. Why would somebody do that? Do you see the difference? Our folks are not people to be gawked at. They are not there to satisfy our own curiosity. If we ask questions, I am begging you, be intentional about why you are asking. Is it relevant? Is it kind? Is it respectful? Because there might be real reasons why we have to ask certain questions. In my case, it was, I don't actually know a lot about this. I know the media tends to sensationalize things. I also know that you're not the only person. So it would be helpful for me to know from your perspective, so I can share that information if there's things that you've learned or that I can improve my own knowledge on, so I can help other people be safer. My intern, lovely person, came a whole long way in a few months. That was I am a spectator and you are an animal at the zoo. There's really no reason to be asking, why would you do that? And our facial expressions are everything too, right? We can ask, what do you get from this? Now, why would you do that? That's not what we do, right? Yes, Devin, the difference in judging and understanding, absolutely. That compassionate curiosity. What are you trying to understand about this person? And if you just have a why would somebody do that moment, that's what Google's for. And even with that, I always tell people to exercise caution, because Google is only as good as the resources that you're looking at, and practicing information hygiene is so important. There's so much misinformation out there, so much biased information out there. Confirmation bias is a real thing. The algorithm is real. So even when you're Googling things, the language that you use, and you can practice this yourselves. If you ask, if you want to know if drinking 8 glasses of water is good for you, and you Google, is drinking 8 glasses of water a day good for you? You're going to find all these articles talking about the benefits of drinking water because of how you worded your question. If you type in negative effects of drinking 8 glasses of water a day, you're going to find different things. So I challenge you to challenge your own algorithm, right? So when you are even doing research, practicing information hygiene, change your wording. And this is something fun that I like to do with myself, because I am such a believer in harm reduction that periodically I try and mess with my algorithm a little bit and say why harm reduction doesn't work. And fun fact, nothing really ever comes up. Or I'll say things like why medication for opioid use disorders is ineffective. or why abstinence only programs are why they are the best way to engage people. So I try and actively look at things that tend to go against my knee-jerk reaction and my beliefs, because I want to see and make sure that I am getting information that is aligned with my values and I'm not keeping myself in an echo chamber. So I strongly urge you to do that. Oh, I'm reading the chat. I doubt the client would have felt safe enough to explain that to the intern. Absolutely. We had a talk about facial expressions, which leads me to my next one. We had a whole conversation about best practices. So first thing that I always like to go over with people is please be mindful of your body language and your tone of voice. I mentioned earlier, folks who engage in drug use, who engage in sex work. I know I'm focusing on those, but you can include this in a lot of other behaviors. We're just focusing on those ones for this purpose. But a lot of times those folks, they are so finely tuned for survival. They have to make very split decisions. Are you safe? Are you going to hurt me? Are you going to arrest me? Can I trust you? So quick that they are extremely perceptive in body language micro expressions. So things like, so if you have any interest in body language, there is a theory of universal micro expressions that no matter who you are, no matter what culture you come from, we exhibit similar facial expressions for different emotions and sensations. And they've done some interesting studies on this with folks who have limited eyesight or who are born blind and have never had that other context. So things like if you're surprised, your eyes kind of go up. If you're afraid, there's kind of like a thing that happens like right here. And they're so quick that it's easy to miss unless you're used to seeing it and can register it very quickly because you are survival based. And one of the ones is this. Anyone see that? Contempt and disgust. It's a slight flaring of the nostrils, a slight curling of the lip. So it might be as simple as, oh, yeah, okay, tell me more. That person very well could have registered all that somewhat unconsciously. And no matter how good we sometimes think we are at hiding our emotions, we're often not as good as we think we are. It takes a lot of practice, So please be mindful of your body language, your tone of voice. I have a very kind of like up and down loud voice at times. You always want to maintain your authenticity, but know when it has to come down a little bit. Know when you're trying to convey something serious. You also want to be calm, but you want to be compassionate. An open facial expression can go a really long way versus, okay, so this is what we're going to do. We're going to talk over here. We might have to call this person. Yeah. No, I hear what you're saying. I do. I don't think I have to ask anybody how that second interaction would have felt. Dismissive, annoyed, bored. Please be mindful of your facial expressions and your tone of voice. Ask permission. This is a big one, even with motivational interviewing. Would it be okay if we always want to give that person the opportunity to say no. I love when people say no. Why? Because so many of the folks that I work with have never really felt safe enough to say no or trusted that their no would be respected. So obviously we want our interactions with folks to empower them to be able to take these skills outside, right? That's what we want. So for somebody who doesn't really get to say no a lot or historically hasn't been able to say no or have their no respected, if I can be that person that they can assert themselves to, that's pretty cool. That's really cool. Because a lot of the folks that I've worked with, when I've asked permission initially, they would say yes. And that one time where I asked, it might be something really simple. It actually happened not long ago. I asked somebody if they wanted to do a photo release and they were like, no. It took me a little off guard. And I was like, oh, awesome, no problem. And I was like, don't make a big deal. Don't make a big deal. Don't make a big deal. But that was a big deal for that person. Be as transparent as possible. What can you do? What can't you do? Don't lie to people. Don't inflate what you can do. Don't make guesses about what you can do. Be honest. And when people offer grievances to you or tell you that something bad happened, please believe them and take it seriously. So there was an individual that I worked with who came in who had a very serious abscess once. And I could see the streaking that was happening up their arms. If you've ever worked with folks who present with skin and soft tissue infections, you know that that's not good. When an abscess starts streaking, that is bad. That means that in all likelihood means that the infection has gone systemic. And this is now an emergency situation, especially if they're spiking a fever, which I could see they were. So this was an emergency situation. So I said to the person, you know, I have to be honest with you. There's not a lot that I can do with you because I'm not a medical provider. So what can I do to help you get medical care? Is there a hospital nearby that you would prefer to go to? And this person had it was verging on a full-blown panic attack. And I couldn't understand what was going on. So as soon as I kind of calmed them, you know, help calm the situation, I said, okay, can you tell me what's going on right now? What's happening? Why is this so scary? And they went on to tell me that the last time that they were at the emergency room for something similar, the nurse that was there that was taking their blood happened to know their mother, grabbed their arm, looked down at them, took their blood, and then kind of pushed it off and said, wow, your mother must be real proud of you, and walked out of the room. And my heart just dropped. And we figured it out, and it took a lot of coordinating to try. And I luckily had a friend who was a nurse at a different hospital. I had her on the phone with the client, reassuring her she was going to meet her at the door and everything was going to be okay. So afterwards, I'm talking to somebody else in our program who was in nursing school at the time. And I was kind of conveying, you know, this was a really difficult interaction, you know, just, I hope everything's going to be okay. And they looked at me and they said, are you sure that's what happened? And for a minute, because this was a friend of mine, for a minute, I had stopped and I thought, and then I tried to kind of rein myself back in. And I said, you know, I don't know that it really matters if that's the exact wording that happened and that's the exact situation, because what I saw was a person who went through something so traumatic and felt so much shame as a result of this interaction that they were listening to me tell them how serious it was, and they were still unwilling to go. So was it the exact wording? I don't know, but I don't know that it matters, because that person had such a terrible interaction with somebody that they felt they could trust. So that's what I mean by taking grievances seriously, okay? Look at how people are behaving, listen to what they're saying. Sometimes there's miscommunication, and oftentimes, unfortunately, I see people in two different capacities. I see my friends and people that I have a lot of respect for as providers. And then I've also been in different situations where I've accompanied people to different appointments, and people can be wonderful human beings in one area and still be disrespectful and not kind and not compassionate in another. We never really know. So compassion fatigue is a real thing. Burnout is a real thing. And we have to kind of keep that in mind, right? So don't assume any shared beliefs towards harm. What I consider to be harmful, somebody else might not. I mentioned earlier, you know, with incarceration, that to me would be a giant harm. That would be extremely harmful. For some other folks, though, not necessarily the same. And we can't assume that people think about harm the same way that we do. We always want to be promoting health literacy. I will say it over and over and over again. Please, please, please work with folks on health literacy. If they were just discharged from somewhere, ask them about their discharge paperwork. Health literacy is more than can you read. It's can you read? Can you understand? Can you articulate what you're trying to say? Can you navigate numbers? Numeracy is part of health literacy. So even when people might have to call ahead for pills, I've definitely had providers say it's so annoying. They call the day before they need something or they're already out, and then what do they want me to do? And I'm thinking, well, they have to properly portion out their pills and then know that they have to call you on day X so that you have 2 to 3 days to get it to the insurance, to get it to the pharmacy. And then the pharmacy might not have it for another day or two. That's a lot to navigate if you're not good with navigating numbers and dates. And those are real struggles that people have. So having a lot of compassion for, that's a great over-explaining. How do we apply this tool with somebody who may deal with extreme anxiety where they overthink or interpret things from a victim mindset? Is it okay to over-explain? So I would say there's a difference between over-explaining and explaining. So giving people like small chunks and seeing how they receive it. So for example, with health literacy, it might be something like, tell me a little bit about how you sort your pills. Setting reminders, helping in like real time. Okay, so let's set a reminder on this date for you to call. So, and what I do in my phone, because I struggle with this, and I've done this with other people, is let's set an alarm on your phone. And this is when you're going to call. And in the notes, this is the number that you hit. And this is then what you're going to do after you call. And then set another reminder in the phone. So if people are good with their phones and calendars, that's a great way to do it. If not, there are often like other people we can link them up to. Case managers can help with this. There are other programs that sometimes with people with chronic conditions, setting up things ahead of time with the pharmacy too. It takes a little extra work. It does. And for folks who struggle with extreme anxiety and ADHD, this is something that there might need to be a little hand holding initially for, but it does have a good payout long term. So it's a little bit more effort up front, and you can kind of set them up for more success, but starting with small chunks, and not assuming that people just waited to make somebody else's life miserable, because that's often not the case. That's a really good question though. And don't assume the person will have the same goals you would. Not to take anything personally, easier said than done though, right? Trust and respect, they can't be demanded. They just can't. I've absolutely heard people say, well, they need to respect me because I'm so-and-so. No, they don't. They actually don't. If you treat them with disrespect and you kind of act like you deserve it, you're going to get a whole lot of people who are not going to meet that expectation. Respect is something that is earned. It is. And we have to understand that not everybody has had a positive experience with different institutions and systems. You have to remember that progress is slow. And a lot of times the behaviors that might be, quote, treatment interfering, those have a very real purpose in terms of survival. So not kind of condemning people for those behaviors, but kind of leaning into what purpose did that survival-based behavior have. Be very careful with saying things like, I know how you feel. This was actually brought to my attention from a peer that I worked with who had a really lovely way of kind of re-explaining this. I'm a person where if you tell me I know exactly how you feel, I'm gonna be like, no, you don't, because you're not me. And I never really could understand a better way to explain this. But they had said what they use was, I haven't been in your shoes, but I have been in the same shoe store. And that always resonated with me because it still allows another person the dignity of their own narrative. By virtue of who I am and what I look like and my socioeconomic status, my education, my background, my credentials, and so forth, if I were to be arrested for possession of whatever drug, my experience in the legal system is going to be very different, very, 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 very different than a transgender Black female who's engaging in sex work who is using the exact same substance. So we might have gone through similar experiences in terms of using a similar drug, but our experiences are going to be extremely different, and our pathways through the recovery system, through the behavioral health system, through the court system are going to be extremely different. So it's important to kind of remember, it's important to give people the dignity of their own narrative, and we can still acknowledge that there are some of those really strong commonalities that can be very comforting to people. Questions about drug use, sexual behaviors, especially when it can provide some context around why people are engaging in certain types of risk. And that cultural humility, I cannot overstate it enough. Understanding from a cultural perspective too, why there are certain risks is a very interesting thing. So a good example of this is in Buffalo. I don't know in your area if you have kind of a similar thing, but in our area, there is a very dominating, or there was, it's gotten a lot better because I launched a very strong campaign to dismantle this. But there's a very pervasive belief in the drug using community here that you could give yourself Hep C. This was a very pervasive myth. I don't know why. I literally can't explain it. The best I can come up with is there was so much focus on not sharing syringes and not focusing on not sharing other works, which we know can carry hepatitis C, that when people found out they were hepatitis C positive, they attributed it to, well, I've been reusing my syringes, so that must be why I got it. That's the best I've been able to come up with, honestly. But it really doesn't matter that much because the drug using community was so insulated that they really only had each other to explain phenomena that nobody else was helping to explain. So very similar to how other cultures form norms and beliefs and mythologies and things like that. So once I understood that this was not a singular belief that somebody had, this is something that was very pervasive in communities and was being passed down almost as a form of harm reduction in these insulated communities as a way of telling people don't reuse your own syringes, I was able to kind of understand, okay, I have to approach it from a cultural perspective. So could it be that can't happen? You don't give yourself the flu, you don't give yourself HIV. Why would this be any different? It had to be, tell me how you came to, tell me how this belief came to you. Who was the first person that told you this? And it was very similar to other cultures. It was an oral history to try and explain what was happening to them in their community because nobody else was helping. So it served a purpose. It wasn't accurate and there was harm that could come from it. And coming at it from a cultural perspective helped so much more than just saying, no, you're wrong. People don't typically take very kindly to being told, no, you're wrong. Understanding, and that is the cornerstone of cultural humility, ultimately. And then please be aware of your own community collaborations and that importance. You don't have to be an expert in everything. Know who those experts are. If you're going to be referring to people to different programs, please think about what those policies are. Don't assume that your folks that you're referring there are going to know. Are these going to be programs where they allow smoking cigarettes and drinking coffee? If they're not, be upfront about it. Know which programs have punitive policies against, and this happens a lot, unfortunately, stealing food, especially with folks who have been, who have grown up with food insecurity and poverty. This can be a really hard thing to understand, that you can't eat whenever you want. And I have absolutely seen people discharge because they were, quote, stealing food. We want to be transparent about that. We want people to know what the expectations are up front and not necessarily put the onus on them, because I don't know about you, but I don't always read the 5 pages of sign here if you understand everything. I know I should, but I don't always. And when people enter treatment, they're often very vulnerable. They might be getting sick. There might be a lot of other things that are going on in their head, anxiety. So we want to make sure that we do our due diligence and set them up for success. Ask people about what services they utilize, what they do and don't like about them. Introduce yourself to those staff so they know who you are. And you can form strong collaborations that way. Know where your local food pantries are. Know when the soup kitchens have the good soup. Know when they have like the good donations coming in. Those can be really great ways to engage people on their terms when you know something is happening in their community that like nobody else really knows about. And whenever you're creating a plan with somebody, please just consider A to Z. Whenever you're doing planning, goal setting, anything like that, consider all the different aspects of what you're asking that person to do. So if you agree, if your follow-up is going to be, I'm going to call you, okay, well, does the person have a phone? No. Are they living on the street and they frequently losing it? How do they safeguard it? What anticipated needs might they have where that phone becomes currency? What other needs would necessitate a phone? Where are they going to charge it? Where can they go that's going to be safe to charge that phone that they're not going to be kicked out of? If that phone's not available, how are you going to contact them? Do you have an agreed upon place? How are they going to get to that place? What is your plan C? So oftentimes I've seen providers get frustrated because a person just kind of falls out of care. That's not always accurate. There's a lot of real barriers that sometimes happen because life, that we don't always know to anticipate, and our folks don't always know to anticipate because they're living it. So this can go a really long way to look at what a person's life is like from A to Z and consider all these different kind of, different potential barriers that, especially for folks who have some complex chronic needs where you want to follow them. What's your plan A, plan B, plan C? And just keep going down that alphabet. You know what else is going to happen? You're going to learn so much about that person's lifestyle. You're going to learn about how safe they are. You're going to learn about their access to food. You're going to learn about their access to safe housing or where they're sleeping at night. You're going to learn a lot from them. And that's all I have for you folks. You all have been wonderful. I've enjoyed, if you were engaging, thank you for that. If you've been following along, taking time out of your day, I thank you for that. I'm grateful for your presence. If anybody needs to get a hold of me, please don't hesitate to reach out with questions. I will be sure that, Rebecca, I'll follow up with you and figure out maybe the best way if people want slides, I'll put them into a PDF. Or if you'd like, maybe it would also be easy too, if you want to email me, and I'll make sure that you get these in PDF too. Yeah. So go raise some hell, change the world. I appreciate you folks.